Thank you everyone for joining us today for this discussion. Just have some quick announcements. I want to remind everyone that this discussion is open press, so thank you for our press who is on the line. Additionally, in a few minutes, we will be taking a group picture at the beginning so that we're not too rushed at the end. And I will pass it on to Secretary. Do you mind go ahead and doing opening remarks while we add in the governor?
Sure.
Thank you. Oh,
And
there
actually,
he is.
I see the governor right there. What an
All right.
introduction. Governor Wes Moore, we can hand it over to the governor for taking the time to be with us. We appreciate, even if it's virtually, that we're in the state of Maryland to discuss an important topic. So, Governor, let me turn it right over to you.
Great, thank you so much, and I'm very excited and grateful to have the opportunity to see all of you, even if it means virtually for right now. But Mr. Secretary, thank you so much for the work, for the partnership. We really could not have a better partner here in the state of Maryland. And President Jarrell, it's great to see you, Secretary Herrera, Scott, and to all the staff and students. And all the stakeholders that are with us today. We are sorry that we have to do this virtually. But the first thing I'll say to everybody is thank you for staying safe. Thank you for making sure that your friends and colleagues are staying safe. And please continue to do so because we're still going to be dealing with pretty treacherous conditions in many parts of the state throughout the remainder of the day. So please make sure you're taking care of yourself. But also just want to take a moment to thank the entire Biden-Harris administration for your work on truly protecting reproductive health in the United States, especially at this moment, right? Especially this time when the Supreme Court is limiting rights instead of expanding them, which is relatively unprecedented when you think about the history of this court of these courts. At a time when there are certain of my colleagues, that certain governors that are making it harder to access basic health care and not easier to be able to access it and frankly, putting their input and their ideas into conversations that the ideas and the opinions of governors or other lawmakers or judges should not be in that conversation. And, at a time when these decisions are being made that are being made involving a lot of elected officials, and they should not be, when some of these decisions truly should be just made between a woman and their doctor. We are thankful that we have an administration in Washington that is truly stepping up. We're thankful we have a secretary that is truly stepping up. And on behalf of so many people in this state and so many people not in the state of Maryland, I just want to say thank you and be very clear that in the state of Maryland, we are going to stand with you inside this work because Maryland will continue to be a safe haven for abortion access as long as I'm the governor. And we have made real progress because one of the first acts that I made as governor of the state literally a year and a day ago was to release $3.5 million in state funds that had been previously withheld to support abortion care clinic training. That decision was purely a decision that was made by my predecessor. And one of the first things we did when I became governor was release that capital. That in April, we announced a partnership with the University of Maryland Medical System, and that was to purchase a substantial amount of mifepristone, because when we saw that there was going to be a challenge, when we saw that there could potentially be limitations on this decision being made between a woman and her doctor, and having a drug that frankly has been legal and authorized for decades, then being challenged, we wanted to make sure that Maryland had enough of a stockpile that would not create a measure of complication for women who are choosing to make this decision. And I'm thankful for the work that our health secretary, Secretary Herrera Scott, did to make that happen. Where in November, we announced a 4-year partnership with Upstream USA to provide Marylanders with equitable access to contraceptive care and also contraceptive education, because we believe both in increasing access to care and also increasing options and education. And that's what this partnership really helped to foster. And at a time when Maryland, and we also know that in this election year, Marylanders will have an opportunity to vote on whether to enshrine the right to abortion care in Maryland's Constitution. I've been very clear that we are going to push and we're going to advocate and we're going to be involved in that process because we want to make sure that the right to abortion is something that exists in the state of Maryland long after I am governor and no matter who the governor of the state of Maryland is. And so I have been very clear that I want Maryland to lead on this issue. And we are going to be unapologetic about it, that access to healthcare touches every part of American life, every part of Marylanders' lives, whether or not you can get a good paying job, whether or not you have the foundation to build wealth for you and your family. And so we owe it to ourselves and to the people of our state, to the people of our country, to ensure that basic reproductive health care is a right and not a privilege. And so I look forward to partnering with everyone around this virtual table that we can have the opportunity to meet this mission. But again, thank you so much for having me, and thank you so much for being such great partners to the people of the state of Maryland.
Thank you so much, Governor Moore. And then we're going to pass it back to Secretary Becerra to give a few words before passing it to Dr. Jarrell.
So first, Governor, thank you for taking the time to be here. This is important, and your being here reflects how important the state of Maryland believes it is. And so thank you to you and your team for the work that you're doing. To Secretary Herrera Scott, thank you again for the work that you are helping the governor do. It is important that everybody be on deck and ready to work. And so thank you to you and your team for what you're doing. And to Dr. Jarrell, is it Jarrell or Jarrell?
Jarrell's fine.
Okay, Dr. Jarrell. And with a name like Xavier Becerra, I always know to ask to make sure that everyone is addressed properly. So Dr. Jarrell, thank you so much for everything you're doing at the university to make campus life and future prosperity be there for all the students that are going to exit your university and remember the campus life that they had. Hopefully it'll be a good experience, and hopefully they believe they're going to be able to do better because they had that chance to be on your campus. To the students, especially the medical students, and to the team at the university who are helping ensure that no one in the state of Maryland feels like they've lost a right, we say thank you. And I hope that what you're able to do is demonstrate to some other parts of the country how precious it is to be able to retain those rights. No one would have said that today a young woman in America would have less rights than her mom or her grandmother, but unfortunately that's the case. And as we know, for too many of those young women, especially if they're women of color, they've never really had all the rights that Roe bestowed on women. And now it's even more difficult for them. And so as we talk about what we're going to do, we want to make sure that rights are respected, that women get to make those choices. At the end of the day, it is about control, who controls your body and who controls your destiny. Because if you don't control your body, there's a very good chance that you don't get to control your destiny. And we want people to know that we're going to do everything in the Biden-Harris administration to work with those who want to make sure that the people who determine the decisions on their own health, their own body, their own destiny will be the people who should have that right, and that's the person themselves. So we're ready to work. We've done a number of things. We're launching this tour around the anniversary of Roe because it's so important to, again, emphasize what we had and what we need to get back and how we can do better. But we also want people to know that there are still rights. You're not without rights, and there are still those who want to fight to make sure we protect those rights, including going to court. So I want to say thanks, President Jarrell, for letting us be with you, Governor Moore, Secretary Herrera Scott, but everyone who's on this call for participating, but especially the young students and the future doctors who are participating here, who really will be the champions that help us get across the finish line, restoring those rights. So again, look forward to the conversation.
Thank you, Mr. Secretary. It's a great pleasure to welcome you to the University of Maryland, Baltimore. This is not your usual university. We are a university very focused in healthcare training, discovery, and delivery. in partnership with the University of Maryland Medical System, who's also on the call, Dr. Mohan Sintha. We have over 3,500 healthcare students and over 900 postgraduate residents training, including an OBGYN, on this campus. So it's a big deal, and it provides a lot of providers to the state of Maryland. So we're very committed to your being here. So here you are, you're sitting in an academic health center virtually. Unfortunately, you don't get to see us. But one of the major commitments we have is to the health of the nation. And you've been very forthcoming in all of this. How can we support your efforts further to protect reproductive health care for women, not just in Maryland, but across the nation?
Well, I'd say the two most important things that come to my mind are, first, getting the stories. And my suspicion is we could hear some really profound stories with the people who are part of this Zoom today, because too many Americans still don't get it. Some folks have not felt the effects of Dobbs because they may be in a state like Maryland that still offers reproductive rights. Some people, unfortunately, don't have that opportunity, but yet at the same time never knew what their rights were while Roe was still in place. And we need to have people who can communicate that from lived experience. We need people who can communicate that because they're in the work right now as we speak. And we need to be able to ensure that no one misunderstands where we are, because we want to make sure that they know what their rights are. But at the same time, we want them to understand the consequences of some parts of America losing their rights. It is now to the point where a woman has to ask, what is my zip code, so she knows what her rights are. That's a pretty devastating statement about the democracy in this country. At the same time, we know that there are people making choices that are detrimental to their health or someone else's health, simply because of what happened in the Dobbs decision. Yesterday, with some students, I was in Richmond, Virginia, and a medical student said to me that in her studies, she was looking, and she was in it from Atlanta, Emory University, and she was going through medical school, and she had asked an OB if she could be her mentor so that she could learn a little bit more about the practicum of OB-GYN. And to her surprise, the doctor said no. And she said, it's not that I don't want to do it. It's that I'm not sure what we would say to you and how we would do it, because we're not sure what we can and cannot do. And I don't want you to misunderstand anything we do. And secondly, this is a more powerful part. There are people who don't want to be known that they are seeking support and services. And so it's hard enough to get patients to come forward. If they see someone they don't know in the room, they may not be completely candid with me as the physician. And so I prefer not to have others in there with me. That's a powerful statement about how we're exercising our healthcare rights and the needs. It's unfortunate, and that's what we have to overcome that. And that's why it's so important to be with you, because first, Maryland, as you heard from the governor, pushes this to make sure everyone has rights. But secondly, all of us can be that witness to what needs to happen and what is happening. And that's so profound.
You just have to scratch your head and wonder how we ever got here at this point in time. Let me jump to Governor Moore for a quick question. Governor Moore, thank you also for being here again at UMB. Are there ways that we can work better with you and other elected officials to make sure that there's access in this state, and can be steps taken at a local level to counteract any potential restrictions on reproductive rights that we're seeing around the state in the Dobbs case?
Absolutely. Absolutely. Thank you. And I, it's interesting because I think we all looked at these issues as solved. I remember during the campaign, having a conversation, we were talking about things like being able to protect abortion rights and looking at abortion as healthcare. And this was prior to the Dobbs decision, when people say, I don't know why you're bringing this up. This is legally, it's a done deal. And everything is until it's not. And I think that one of the things that people saw was just how quick that turn happened and the very real human implications that it meant for women in our state. And so the only thing that we knew how to do was to be able to move in partnership. That, it really is kind of a, just a hallmark of the way this administration really does its work. And we knew that moving in partnership really meant that we had to work with the private sector. We had to work with nonprofit partners. We had to work with our federal partners. We had to work with our institutions of higher education, yourself and, and NUMS and everybody, Dr. Sunta and everybody on board to ensure that we were going to protect the rights for people in our state, and in this case specifically for women and reproductive health. And so it meant that we would actually build bridges and work in partnership between the State House and University of Maryland Medical System to do things like stockpile mifepristone. And again, I give another shout out to Secretary Hedda Scott for just the remarkable leadership and the speed that happened to get that done. That it meant building partnerships with nonprofit organizations like Upstream that we spoke about before, which is a nonprofit that really focuses on education and access to contraceptive care. And so we just knew that there wasn't something that the state government alone could be able to do, or the executive branch alone. This was going to be a combination of executive orders. It was going to be a combination of working with the legislature. It was going to be a combination of working with partners outside of government to be able to not just lay the blueprint, but make sure all the various productive elements and both reproductive elements and protection elements and privacy elements all made it into the way that we do our business and how we were going to protect rights in our state.
Thank you, Governor. I think in the interest of time, let's get to the panelists so that you can hear from them. And I was originally going to introduce you sitting around a table, but what I'll do is introduce you as you speak, if that's acceptable. And I would like to start with Secretary Herrera Scott. Secretary, thank you for being here. I'm proud that you're a graduate of our Family and Community Medicine residency here at UMB. I know you're very tuned in and involved with the OBGYN workforce, the providers in the state of Maryland, particularly as it relates to abortion care. Can you tell us a little bit about the recent initiative you have taken to address the provider rates for abortion care in Maryland?
Sure, and thank you for having me, Dr. Jarrell. And, just to echo what the governor said, the department's success and the state's success could not have happened without the partnership from University of Maryland and University of Maryland Medical System. So I want to thank you and Dr. Sunta for all the support you've given me in our role and what we're trying to do. But what I heard on some of the visits I was able to do with the governor is, if we're trying to ensure access, we need to make sure we reimburse our providers enough to that maintaining that access is essential. And what we heard over and over again, that our reimbursement rates were not adequate. And so the Department of Health did a thorough review of our Medicaid abortion rates. We looked at rates across the country, and having listened to our providers and heard about what was needed to build a strong infrastructure of care delivery, we will soon be increasing our medical and surgical abortion rates for clinics to be among the highest in the nation. And that change is going to go through in the next 6 weeks. And so we've leveraged the resources that Governor Moore has given to the department to support not just training, but then making sure reimbursement is adequate. In addition, because of our partnership with Upstream, we also wanted to look at our reimbursement for long-acting reversible contraception and where we were on that. And again, we found that they were not adequate. So doing, again, a national search and what other states were doing, we will be increasing our Medicaid rates for long-acting reversible contraception to be among the highest in the nation. And these increases will further strengthen Maryland as a leader in reproductive access and support in the country. And because of the timing of the investments, we are going to be able to provide some grants to Maryland Family Planning and Reproductive Health Program through grants distributed to providers and family planning services, as well as grant opportunities to abortion clinics, because they are providing a lot more resources besides the service itself. They're providing behavioral health support. They're providing transportation, as well as additional infrastructure needs at the local level. So we are really excited not only in the changes we're making for reimbursement, but the ability to support family planning and reproductive health programs in a way that we haven't previously. And it's just our ways that we're going to continue to make changes to protect the reproductive rights of Marylanders. And these new investments will help us continue to do so.
Thank you, Madam Secretary. We also have on the call Dr. Jessica Lee and Dr. Mary Jo Bondi. Dr. Lee is an OBGYN practicing, and Dr. Bondi is a physician assistant and well-known educator in this area. Maybe I'd begin by asking the two of you, since the Dobbs decision, has anything in Maryland changed in reproductive care and services? Are you seeing anything before and after Dobbs? Dr. Lee?
I think we were all prepared, unfortunately, to see Dobbs occur with the leak that happened a few months prior to it. But I will tell you, the day that decision was handed, I had Maryland patients calling me saying, is abortion still legal in Maryland? Because that's how confusing legislation is when these court rulings go about. People they thought we were closed that day while we were still providing abortion care and reproductive care. So it was like a switch flipped, because everyone follows social media and national media, and they don't always know what's going on the state side. And so I'm very appreciative for everything Governor Moore has done for us in that time since. I will say, in general, we're seeing higher volume. We're seeing patients from out of state. Florida and Tennessee come to mind. Funny enough, BWI is a Southwest airline hub, so people find it cheaper to fly to us than to even drive to other states. So we are really becoming a safe haven for patients in those other states that cannot seek care. I mean, the moment this happened, my colleagues in restrictive states were scrambling, and I was so empathetic for them. But us in progressive states were also scrambling as we sought to find ways to handle the volume, make cash pricing packages, because people will not get usually their insurance to pay across state lines. So now I'm looking at what is the dollar amount that's fair and reasonable to charge patients for this care, as well as expanding the ability for providers to handle the higher volume. So it's like overnight, things really changed, and they changed a lot for practitioners and our students too, in considering what they're going to choose for their future career, as well as where they're going to practice.
So do you think this is going to affect the supply of OBGYNs around the nation and in Maryland? Will there be states that get more and states that get fewer?
I think we're already seeing a little bit of a shift. There was a recent study from the AMA where in states where abortion is illegal, they had 10% fewer OBGYN applicants. And I feel for the people, those families in those states, they're going to feel that crunch with less OBGYNs. And I know Secretary Becerra's wife is an OBGYN, so I'm sure he's very aware of how few of us there are that are needed in this country. So we're seeing shifts already. MJ?
Right. So building off of what Jessica said, my physician assistant colleagues have told me that reproductive health clinical education opportunities have become less accessible since Dobbs. And so access to clinical education provided by practicing clinicians is the cornerstone to preparing a competent workforce, whether that is physicians, physician assistants, nurse practitioners, or certified nurse midwives. And so we really need those partnerships to be able to continue to provide that clinical education and mentoring.
Thank you. And the Maryland Department of Health is working on a grant with the two of you regarding increase in qualified abortion care providers. Could the two of you tell us just a little bit about that?
So Governor Moore, first of all, thank you so much for your leadership and for releasing the training funds allocated in the Abortion Care Access Act. We are so grateful for the opportunity to serve the state. As a physician assistant, I felt that it was a wonderful recognition that you have a workforce ready to respond to the needs of the state. And here at UMB, we believe in interprofessional education and the benefits of team-based care delivery. We've come together as a cross-disciplinary team to educate physicians, PAs, NPs, certified nurse practitioners, as well as certified nurse midwives to improve access to contraceptive and abortion care. We are partnering with our friends at Planned Parenthood, and we are approaching this through an abundance lens rather than a scarcity lens. We recognize that we have over 4,000 PAs in the state of Maryland and over 4,000 licensed family nurse practitioners who can come alongside our physician colleagues and really help extend access to care and do it safely and competently. We've designed an opt-in fellowship program that will model team-based care. It'll be taught by multiple providers, and it includes didactic, simulation, and clinical training to upskill the current licensed workforce. Our aim is to diversify the workforce, improve access and convenience of care delivery. And then further, we're building a capacity to provide this training to the future generation of physicians and advanced practice clinicians in the state as well. Jessica, anything else to add there?
No,
Well,
we're so thrilled. I'm sorry, Dr. Jarrell.
Oh, please, Jessica, go ahead.
As you know, some other states are joining us in this kind of parallel fight to expand access, California, New Jersey, and we are so excited Maryland's right alongside with them leading the way.
So I wanted to make sure Secretary Becerra heard about this because it's really a step forward. It's almost all hands on deck. Let's get this problem addressed and get more providers out there. So it's an exciting program to be a part of. I'd like to move to our two medical students. One of them is Jackie Lasola. Jackie, and the second is Haley Hauser. Both graduate this year. Jacqueline with her MD and PhD, and Haley with her MD, and both are going into OBGYN residencies. So congratulations on that. Now, you've just finished the interviewing session, haven't you? So you've been all around, not just Maryland, but other places. So what are you hearing about OB training in other states, and what are you hearing from fellow students in other states?
I can go ahead and get started. So it absolutely has become center of the conversation in terms of how people are evaluating programs. I think that when you go across the country and meet people from throughout the country, very talented physicians in training, one thing that's very striking is that you have people who really identify with communities that are currently restricted in terms of what type of abortion services they can provide. However, they know that to train in that state would mean that they're severely limiting their actual training. And on top of that, programs are trying to provide promises that they'll work out some sort of partnership with training in a state that is more permissive to abortion care. But the reality of it is that if you're not able to practice the skills, and that includes both the actual technical skills as well as the ability to counsel patients accurately in the moment of a clinical encounter, you're not getting the training that you need in order to provide obstetric and gynecology care in a way that is equitable as well as comprehensive.
So you think this is changing medical students' opinion about what career they will go in a negative way, I might add?
Absolutely. I mean, I think that from the people that I've met through the process, there definitely is an emphasis on trying to find programs that have enshrined in the training program the access to abortion care, but also for people who really had no interest in getting involved in politics, there's this huge push for advocacy. Everybody wants to be a part of the fight, and everybody wants to be there at the Capitol steps in their home state, fighting for ensuring that rights are protected for all people who become pregnant.
Haley, you're a student leader here in the university. What are you hearing from your fellow students? What do you think it's doing in terms of changing their view of medicine or changing their view of government? Take your pick.
I think that we all hold a similar opinion, and I think most of us, we go into medicine, to help people. And throughout our training, we're constantly taught, do what's best for the patient at all costs. And I think this being brought up, especially in the middle of our medical school training, has taken people aback, and they've kind of questioned, I'm being told from an outside source that I can't do what's best for the patient, and how am I going to react as a future physician? And I think it is impacting people's decisions to go into OBGYN or not, which is devastating. But I also think that those of us that have chosen to go into OBGYN are even more excited to join the field and join the fight and continue to fight for our future patients and provide them that access that they deserve. And I would attribute a lot of this to Maryland, because as students, we get access to abortion care and training, and we can do electives with these women. And I think being able to walk through this process with patients changes your opinion and it changes your view. And we all say that we're pro-choice, of course, and we all want to do what's best for our patients, but to really sit down with an actual patient and walk through this with them, it's something that you don't feel like you could deny them ever. And it really changes kind of what you're going to do moving forward. And even like Jackie said, programs are telling you that, we'll send you for a month to train and do this, but you have to go in knowing that you won't be able to provide your patients the care that you believe that they deserve. So I think it's a difficult time.
Thank you, Haley. Jackie, anything to add on that?
No, it's absolutely true. It's a difficult time. And I think that for many of us in the field, it's really about how can we get more creative about how we provide these services. And I think partnering with advanced practice providers is absolutely a great idea. And then I think one thing we don't appreciate is that family medicine physicians play a key role in a lot of abortion and pregnancy services. And to see really an interest amongst other providers for that is absolutely going to be essential to protecting their rights.
Great. Well, thank you very much for these opinions and giving us that information. I want to move to our two last commentators. And Mr. Secretary, one thing I didn't want to be lost upon you is I think you already know that Maryland operates under a unique Medicare waiver model that was put into place by your department decades ago. And this is particularly a relevant discussion to this discussion because I didn't want that to be lost on you. As you may know, we've recently shifted from a fee-for-service model to a global-based budgeting model, which rewards value-based care and population health. And we have 3,500 health-related students and 900 medical residents now training under this new model. And we thought it was important to make sure that you saw the perspective of what this value-based medicine is doing relative to women's health. And I'd like to introduce Dr. Mohan Santha, who's CEO of the medical system. Dr. Santha?
Thanks, Dr. Jarrell, and Governor Moore, Secretary Scott, Secretary Becerra, thank you. I've had the opportunity to speak often to Governor Moore and Secretary Scott about the unique position Maryland finds itself in as a consequence of the unique relationship the state has with the federal government. We, as Dr. Jarrell said, we are in a position where we are teaching the nation about the evolution of healthcare from a volume-based reimbursement model to a value-based reimbursement model. And that value is foundationally rooted in the concepts, Secretary Becerra, that you brought forward, which include the concept of access, ensuring access, the concept of health equity, to ensure that when we think about resource utilization and when we think about how we keep communities healthy and vibrant, the state of Maryland is educating the future workforce, the students, the residents that you've heard from. We function in a world that is foundationally different, and we would argue demonstrates the evolution of healthcare delivery. And so when you think about women's reproductive healthcare rights, when you think about women's healthcare overall, and you put it within the context of this evolution that the state of Maryland is driving for the nation, which is really a value-based healthcare model, it really does drive and incent investment in keeping communities healthy and access outside the walls of hospitals, outside of the acute healthcare setting. And so I think the relationship between the state and the federal government around this unique model, the evolution of this model, is going to continue. We have shown successfully that we can bend the cost curve, that we can manage healthcare cost expenditure growth. I think the exciting evolution of this model is how we continue to demonstrate that we can also lead in health equity, that we can lead in healthcare access, that we can lead in some of the ways that Secretary Scott and Governor Moore emphasized, that can teach the nation as we go forward, because this will be our collective responsibility. As an academic health system, partnering with our university colleagues, we take this responsibility incredibly seriously. So Dr. Jarrell, thank you. Thanks for highlighting for Secretary Becerra the importance of this unique relationship Secretary Becerra, thank you for the federal government leaning in with the state of Maryland in this unique partnership.
Thank you, Dr. Santha. Compulsive that I am, a person that I am, we have 4 minutes left. So I would like to introduce Dr. Kyle Bukowski, who leads our Planned Parenthood program here right next to the university. Dr. Bukowski, what changes in community needs have you observed post-Dobbs, and what do you see evolving in the community?
Thank you so much, everybody, for having me. As you know, Planned Parenthood is one of the largest providers of abortion care across the country and absolutely in the state of Maryland. Most of that care is provided by nurse practitioners and midwives. And so I really appreciate how open-minded Maryland has been about expanding access. We were the first people to train procedural abortion for nurse practitioners right after that law went into effect on July 1st, 2022. So when I think about community need, I think there's both internal and external. Even before Dobbs, we were not meeting the abortion access required in the state of Maryland. And in the first year after Dobbs, we saw a 45% increase in abortion volume. We saw a doubling in out-of-state travel. As Dr. Lee pointed out, we're seeing patients from the DMV area always, but particularly we're seeing more from Florida and Texas and the Midwest and South. Interestingly, since North Carolina's ban went into effect earlier this summer, we're now seeing more Virginia patients because Carolinians are pushing to Virginia and Virginia is pushing into Maryland. We've seen that significant increase over the past 3 months. So when I think about community need, it is tempering chaos is kind of how I approach it. So for people in Maryland, it's making sure they have access to the healthcare that their state dollars pay for already. And then how we as a state function as a haven for the rest of the country that needs the care so desperately. And that means breaking down barriers. So one of the things that we actually did pre-Dobbs, even before the leak, because we knew this was coming, is we got all of the abortion providers in the state of Maryland and surrounding region together and said, how are we going to help navigate patients whenever this happens? Patients don't care if it's University of Maryland or it's Hopkins or it's Planned Parenthood or it's an independent abortion provider, they just need care. And how do we break down those barriers and get patients to the care and not worry about who's coming to our clinic versus your clinic or whatever. We talked about getting cash pricing at hospitals because we knew patients were going to travel out of state and need in-hospital abortion care, which is a small percentage of the care that's needed for abortion, but can be extremely expensive. And if there's not a cash price available, abortion fund money can't follow that patient. So it was really about looking at the larger abortion providing ecosystem, providers, abortion funds, practical support, and getting us all on the same page. And I would say that we were extremely effective, and people look to Virginia, DC, and absolutely Maryland as a haven. And we are kind of the last bastion. We are the farthest south state that still is providing access in addition with Virginia. And even Virginia is always in a precarious situation. So I just really want to thank my colleagues for being open-minded and breaking down as many silos as we possibly could to meet the needs of the patients that were coming here and that already live here.
Thank you, Dr. Bukowski. So, Secretary Becerra, you've just seen Maryland in a nutshell. I hope it's given you a nice view of our great state and our University of Maryland, Baltimore, and the circumstances here. We, of course, are open for questions, and I think, Katya, you have plans now for the press to ask questions?
Yes, in a minute. We will be taking a group photo, and then, Mr. Secretary, if you do want to give any last closing remarks before we ask the rest of you to log off so that the governor and the secretary can stay on with the press, I'll pass it on to you, Secretary.
Yeah, and Governor, I'll ask you to say a quick close as well before everyone has to leave. But can I use my time to just ask a question of both Haley and Jackie? Interested to know if Maryland is your original home state, and interested to know where you plan to practice, because when I asked that of graduating physicians, especially those, of course, who are going into OB/GYN practices, it is interesting the response I get. And so hoping you can tell me where you're from and where you're planning to settle your practice.
I'm from Baltimore, Maryland. Actually, I was born and raised here. I think we're both in a hard position right now because there's a lot of unknown ahead of us. And with the whole match, you know, you can't really anticipate completely where you're going to practice. But I personally would love to stay kind of in a Maryland, New York, New Jersey area so that I can continue providing this access and train and be able to help patients.
I am actually a Californian. I'm from Northern California. I'm from Vallejo, California.
Oh, yeah.
Yeah. So where I'm looking to practice, this is kind of a loaded question because our rank lists have not yet been submitted, and we do have people from our department on the phone.
But I know
I
the two
think
of you are stellar and going to get placed wherever you want. You're going to get your first choice.
Yeah, I mean, I think like for me, it's really important that in terms of residency training, I do train at a place where abortion care is protected and integrated into everyday clinical service. And so that's a priority for me. But I think that when it comes to where I eventually see myself end up, it's really where's the need. And unfortunately, not only do we see less people wanting to train in states where abortion access is restricted, but we see less providers overall who practice there. And it's a travesty that in a state like Idaho, you are seeing providers pack up and leave on a regular basis. And these are places where we have maternity care deserts. And I think that eventually my career path will eventually lead me to someplace like that.
Well, I think Governor Moore and I are very lucky that Maryland and California are graduating some, future leaders in healthcare. And chances are we're going to probably see you somewhere nearby in our states. But it also speaks to what this means to every other state and the people who need the care. And that's the unfortunate part. And that's why I said at the very beginning, your stories are the most powerful ways to communicate this, because when people hear from you, and you are the people who are going to be providing care to women in the future, to hear that it's unlikely that you're going to be locating in a particular state that's restrictive in care, regardless of the reasons, it just means that there are populations in these states that are not going to have the professionalism and the skill that you would bring in, and that's a travesty for any nation to have that type of situation, tale of two cities. And so that's why it's so important we do this. Governor, please, some final thoughts before we have to say goodbye to everyone.
Mr. Secretary, thank you, and I can tell you both for Haley and Jackie, they'll be Marylanders. We're going to make sure that they stay here. But I tell you, we mean that because we in Maryland, we want to make sure that we're keeping the best. And you represent the best. You represent the best of us. And we're honored that you call Maryland home. Ms. Secretary, again, I just wanted to again thank you so much for the leadership and for the partnership. When you have a chance to see and hear from us, literally some of our state's finest, Dr. Jarrell and Dr. Something and Dr. Herrera Scott and MJ and Dr. Lee. I mean, these are literally and Dr. Pakowski. I mean, these are some of the people that make us so proud to be Marylanders and make me incredibly proud to be this state's governor. We know that our ability to be able to protect reproductive rights, it is going to be an all hands on deck, and being able to use every single measure we have. And that will include passing legislation like we did this past session that focuses on protecting privacy and making it illegal that no one will come here and be prosecuted for getting their health care in the state of Maryland. Things like what's going to happen in this next election cycle when in Maryland we will get it on the state's constitution. So that no matter who the governor is, and no matter what institution, no matter what administration sits here, knowing that reproductive health will be in the Constitution of the state of Maryland, regardless of what a Supreme Court decision or any individual Supreme Court decision, what they do. I mean, so there are things that we can and we will do using budgets, using legislation, using executive orders to be able to protect reproductive rights. And I do, and Jackie, you said something I just also want to close on with, which I think was really important too. It's not just because it's the right thing to do. It's not just because it's the that we have a moral obligation to be able to make sure we're protecting healthcare for every single person in this state. We also want to let people in other states know that this is a place that we want to be welcoming for you to work, welcoming for you to raise a family, welcoming for you to be able to grow your enterprises, for entrepreneurs and people who are running businesses. If you want your business to grow in a state where you know that your workers are going to have basic healthcare protections, come to the state of Maryland. This is both because it is the right thing to do. It is both because we believe in reproductive freedoms, and we believe in choice. But it's also saying that this is also going to be a very competitive advantage to the state of Maryland. And for people who are living in states, for businesses that are growing in states, for individuals that are teaching in states or working in the public sector in states, where your basic freedoms are not being met because of political decisions, come to the state of Maryland, because we would love to welcome you and we would love for you to stay here and build your families here as well.